Across Alberta's Métis Settlements, a meaningful change is taking place. Through the Enhancing Access to Métis Settlement screening, communities are working together, reclaiming their health and strengthening their futures. This story shares the voices and experiences of the Métis people of Alberta as they lead cancer prevention efforts rooted in identity, culture, and community strength. And to understand why this work matters so deeply, we first look at the everyday realities Métis communities face when accessing healthcare. For many Métis families, accessing healthcare isn't always straightforward. Long distances, limited local services, and past experiences of discrimination have created barriers that make screening more difficult.
You know, we're a very isolated community as Fishing Lake, and it's close to an hour drive to any town. Even doing the things like going to town for tests, it's all expensive, and a lot of our people don't have that money.
A lot of people don't get the proper screening or help they need because of where we're located and how far it is to go.
You know, when you live in a big center like Edmonton or Calgary or whatever, you have a lot of opportunities, a lot of options that you can do, doctors that you can see.
Well, if we had these facilities here, because it costs lots for us to travel to Edmonton to go get treated, it would better us here, benefit us community members here more than us having to travel.
Our community, our members, they miss out on a lot. They miss out on a lot of medical appointments, important medical appointments.
You don't have doctors on site available for you every day. We have to travel to town to go and see a doctor. So you're looking at 60 kilometers one way, 120 home.
And then other people around Kikino that are young, around my age, just, all of a sudden cancer and gone. And they, the reason why is because they never bother to go get checked out because they have that barrier, like, to go see the doctor.
It's like, do I buy food or do I go to this appointment? And if you got 4 or 5 kids at home, guess what you're going to do? You're going to buy food and you're not going to be worrying so much about your own health.
At the heart of these challenges, something else becomes very clear: why early detection and access to screening is so vital. Cancer affects Indigenous peoples at disproportionate rates. Delayed diagnosis, limited resources, and lack of culturally relevant care all contribute to these outcomes. Screening changes that. Early detection leads to better outcomes, more options, and more time with the people we care about.
So last year we had a mobile screening clinic for our men, and we had 28 men show up, and they were super excited about it. They were very open about their experience with it, and they were very surprised, pleasantly surprised, I would say, that how easy it was.
There's a lot of misinformation about it. And I feel like the more you talk to people, the more you actually physically engage with them and have those one-on-one conversations, the more they understand, and then they're not so shied off about it or like thrown off.
For other men to communicate with each other was awesome to see, sharing their results, which they didn't have to, but they were a lot more open to it, and it was a great turnout.
We've heard cancer for so many years. I'm hoping, and I think I can see it, that you will have people waiting for the man van to park, because they got to work, but they got to look after themselves first, right? The men in this community are starting to see that. I can't feed my wife or my kids or my grandchildren if I'm not healthy. So when that man van shows up, it's hope.
Like, some people are just scared of not knowing, but those are the people that you actually have to reach out to and explain, hey, this could save your life.
It's here right in our hall, so it's very accessible for our members. Those who don't have vehicles, we will go out, drive out and pick them up to bring them in. So in that sense, it's such a benefit to them to be able to have access to it right here at home.
So when you give these people information on the testing itself, what to expect, how long it takes, you give them all this information, it eases their mind. It eases their cancer scare.
When they first come to us, they're really a little nervous and skeptical. Once we kind of get through it and show them what's involved, what we want to do for them, and the reason why we're here, they really start to lighten up to it.
I think getting those buses out to your community is one of the highest levels of importance in saving your people and giving them the resources and knowledge and services to save themselves and possibly pass on information to save a family member.
Again, through education and through teaching about, say, prostate cancer, the earlier detection, the better survival rate, the better treatment rate you have. Guys are picking up on this now.
So if you come and screen, not only, number one, are you looking after your health, you may get an early diagnosis if you do have a situation. You have an opportunity to mingle with others. But more importantly, ultimately, is we want them screened so we get that early start should there be any cancer.
Go get checked. It doesn't hurt. You know, it's a needle. Tell your doctor, hey, I want to be tested, just to make sure.
A lot of people, the ones I've talked to last year and this year, some of the men are repeating. They were here last year and they came back again this year, right? And what I'd like to hear is thank you. Thank you for what you're doing. You know, I'm glad I can do this now. You know, you're bringing a service to our community. We don't have to go out and do it.
Cancer screening is such a vital importance to it be your loved one or any one of our community members, that getting to get that screening would just help yourself in dealing with the situation you're in with cancer.
One of the strengths of the Enhancing Access to Métis Settlement screening is that it is guided by Métis community leadership. Workshops, conversations, and events are shaped by local knowledge, values, and traditions.
The EAMS project is giving an Indigenous approach to prevention and screening that they didn't have before. Taking what Alberta Health Services gives us and making it work for our communities. Because what works for Kikino might not necessarily work for Fishing Lake, and that's just the reality of it.
We are connected through Kikino and Fishing Lake, and we work together on different ideas for programming and what does this project look like for our community members and what works for them.
There's been, so many surveys and talks, formally, informally done, saying what is it that we want as a community? What areas do we want to target?
And when you bring people together, it just creates this weave of information that they can use and that they can follow for themselves or ask for help, ask for guidance.
And the role that knowledge holders and elders have in this project, I think, is very instrumental. They're able to guide not only our workers, but also people from AHS that maybe aren't as familiar, with the culture and some of the barriers that we have.
And plus you get to integrate with other community members and, kind of like speaking of cancer. Not everybody just goes and tell people, oh, I got cancer, eh? But like when you get to visit, like when community events, it kind of comes out.
They do feel like they have a say. They do feel like they're a part of it, which they are. That they are who I'm working for. They are who we want to promote the screening and the prevention, all of that stuff. And, it's a lot of hard work bringing out information, but once you do, the community really, receives it well.
When you create things, you're giving them information where we have that family connection, to have that community involvement. And that's key, because you need to be able to socialize, because I find if you socialize and you learn, then you're healthier.
And with strong leadership comes strong results. Signs of change are already taking root across the settlements. The vision for the future is clear: continued education, more accessible screening, and stronger Métis-led health initiatives across all settlements, which include a consistently funded salaried position in each community.
Since the project started, a lot of people are more aware of their health, their family's health, encouraging them to see a doctor, to follow up on results, really take charge of their own health.
Through part of this education is teaching people, obviously depending on the cancer and early detection, is how much more successful you can be in maybe overcoming it or having it treated. And so I think the program, as it's progressing, is it's teaching people that. So they're not kind of keeping their head in the sand anymore. They understand that they're kind of captains of their own ship, and that with some help and some guidance, they can navigate through this.
It's great to see people changing and looking better, feeling better. It's just overall good health. And now with the screening, it's just, the icing on the cake basically is like, okay, well, what else can we bring in? We got our men covered, we got our women covered, so what else can we do to, get the importance of screening across to our community members?
My hope for the future, that even after this project ends, is that we've given enough resources, information, and services that it helps generations to come. My biggest hope is that eventually another project will come along and we'll be able to sustain the work that we started.
I want to put a huge thank you out and my gratitude to the frontline workers in these programs that really go above and beyond, and they are in it for wanting to help their people. They are the heart and soul of this whole project, and without the frontline workers that are doing such a remarkable job, as well as the elders and the knowledge holders that provide that support, it wouldn't be as successful as it is. And I just want to say kudos to everybody who worked so hard on this project.
This is how reconciliation becomes a verb and is turned into action. The vision for the future is clear: continued education and funding, more accessible screening, and stronger Métis-led health initiatives across all settlements. This work reminds us of something the Métis have always known: that health is strongest when it grows from culture, community, and connection. Enhancing access to Métis settlement screening shows what is possible when Métis people lead the way, when care honors identity, when partnerships listen, and when families come together to support one another. This journey continues, and every voice, every choice, and every screening helps shape a stronger tomorrow.